Dr. Gary Grosner is a longtime cardiac surgeon at the Buffalo General Medical Center and Gates Vascular Institute. He joins us today on Medically Speaking to talk about cardiac-related issues in the midst of the pandemic. Dr. Grosner, thanks for joining us today.
You're welcome.
So if you can, let's start with how the cardiac world has been impacted by COVID-19. We're hearing stories of people possibly with heart attacks or strokes, and that may either be decreasing during this. We've also heard that people are ignoring possible cardiac issues. So if you can, tell us a little bit about how your world has been impacted by this.
We believe that people are not seeking healthcare because of the anxiety of coming to the hospital. We think people are staying at home and ignoring symptoms.
And so is that something that you're hearing from your colleagues across the state and across the country? Is this kind of universal for people that are ignoring their personal health?
Yes, we've heard as high as 70% decrease in the incidence of myocardial infarction, which there's no other way to explain it except people aren't coming to the hospital.
Sure. So if you can then let's start backwards then. So normally by the time a patient gets to you and you're performing an invasive procedure, but so if they do put off their heart condition for 30, 60 days, say starting in mid-March and it's now June, what are some of the issues and challenges that come with that?
Well, patients with serious heart disease without seeking healthcare risk really terrible things such as sudden death, heart attacks, strokes, things that are correctable.
And just for the viewers who may not be aware, just explain, if you can, briefly the connection between stroke and heart attack, and how someone who has either cardiac disease that they know of or may not know that they have a cardiac issue, how those two can be related.
All are related to the heart and the vascular system. They're all intertwined, and people who have cardiac problems are at risk for developing strokes and vice versa. People who develop strokes have cardiac issues. Right.
So people who have maybe put off their cardiology appointment or their annual checkup, their annual physical, or someone who may have signs and symptoms, but they're ignoring it. They're having some chest pain, they're having some weakness. Those are things that the cardiology world is saying those are danger signs that should always normally be taken care of right away. But these are things that really have been ignored during the pandemic and are kind of becoming problematic for you guys now.
Yes, patients we see now are sicker. They have already had previous issues during the scare, and that makes the risk of what we do greater. So patients should not ignore symptoms such as chest pain, shortness of breath, passing out, dizziness, all these symptoms patients should not ignore, and they shouldn't be afraid to come to the hospital.
So let's talk about that a little bit. The hospital was very, very quiet for about 100 or so days when visitation was restricted, and there were fewer and fewer patients coming into the hospital. But that didn't mean it wasn't a safe place. There's an awful lot of precautions and things that happened to make sure that patients were safe, employees were safe, physicians were safe. Tell us why it is safe for heart and vascular related issues and potential patients to come to the hospital.
We think that it's safe because all people practice social distancing and wearing masks, and cleaning their hands and washing their hands appropriately. All patients who come to the hospital for elective surgery are tested for the COVID-19 virus. We have strict limitations on visitations. In other words, patients cannot come to the hospital with a whole entourage of their family, unfortunately, and I know this creates problems for families, but we've limited the amount of visitation, which I think is helpful as well.
So when you or your office is dealing with patients, or when you're dealing with patients right now, what are some of the concerns that they bring up, or how do you walk them through that challenge of Doc, I realize I need surgery. I feel okay. I think I can fight it for another 30, 60 days. I just don't want to come right now. How do you help educate them and walk them through?
Well, I think you have to tell the patient and show the patient the studies and show them what can happen if there's delays in their treatment. And once patients see the angiogram or the echocardiogram and they realize how severe their issues can be and how severe their symptoms can lead to disability and even death, I think patients seem much more inclined to want to go ahead with surgery. And I think that's the main key for me anyway. I have to show them.
So, in terms of the surgical patients and the fact that people have been putting it off, why is it such a challenge that they're sicker or that the condition's worse from your perspective in terms of what it may do to the challenge of when they do go through surgery?
Patients that I see generally have more symptoms, and they have suffered heart attacks without coming to the hospital. Their heart function is not normal anymore. The risk of surgery, of course, from those things increases. We see people who are more ill. Yeah.
So, Doc, as we wrap up here, there's obviously, the COVID-19 has been a challenge for everyone. It's put a further complication into the physicians' lives in terms of trying to ensure that people are coming for their routine care. You're sitting in the office, or you operate at one of the world's most renowned cardiac centers. Tell us a little bit why it's important for people to get to Gates for their cardiac condition or to have their cardiac issues taken care of.
You shouldn't delay any sort of treatment for cardiac issues. Delay leads to problems. Problems lead to increased risks of procedures as time goes on. You shouldn't ignore symptoms or be afraid to come to the hospital at this point.
Great. So thanks, Dr. Grosner, for joining us today on Medically Speaking. Appreciate your time and insight on cardiac issues during COVID-19.